Your body often whispers before it screams. The earlier you recognize these warning signs, the better your chance of protecting your vision, nerves, kidneys, heart, and overall health. This video helps you recognize those whispers before they become something much harder to ignore. What if your body has been warning you for months and you didn't even realize it? That's the surprising truth about high blood sugar. Many people expect a serious health problem to announce itself with severe pain or dramatic symptoms. But when it comes to blood sugar, the earliest signs are often so subtle that they're easy to brush aside as nothing more than getting older. Maybe you've noticed feeling more tired than usual, needing an extra glass of water, or waking up more often during the night. These changes can seem small on their own. Yet, research suggests they may sometimes be your body's way of signaling that something deserves closer attention. The good news is that recognizing these early clues can make a real difference. Blood sugar problems often develop gradually, giving you an opportunity to take action before more serious complications affect your eyes, nerves, kidneys, or heart. That doesn't mean every symptom points to diabetes, but it does mean they're worth discussing with your healthcare professional instead of ignoring them. In today's video, we'll count down 10 warning signs, beginning with the ones that many people dismiss and ending with symptoms that deserve immediate attention. Along the way, you'll also learn why these changes happen and discover practical habits that may help protect your long-term health. Let's begin with one of the earliest warning signs that many people overlook because it seems completely harmless. Have you found yourself carrying a water bottle almost everywhere, yet you still feel thirsty? Maybe you wake up during the night reaching for a drink, or your mouth feels dry even after finishing a full glass. While warm weather or certain medications can cause thirst, persistent thirst can sometimes be one of the earliest signs that blood sugar is running higher than it should. Think of your kidneys as an overflow filter. Their job is to remove waste while keeping the right balance of water inside your body. When too much glucose or sugar builds up in the bloodstream, the kidneys work harder to remove the extra. To do that, they pull more water into your urine, leaving the rest of your body feeling dehydrated. That's why simply drinking more water may help you feel temporarily better, but it does not correct the underlying cause if blood sugar remains elevated. If this thirst lasts for days, keeps interrupting your sleep, or appears alongside other unusual symptoms, it's wise to speak with your healthcare professional. Early evaluation may identify a problem before it becomes much harder to manage. But thirst rarely comes alone. It often arrives with another symptom that sends many people back and forth to the bathroom, sometimes long before serious complications become obvious in everyday life begins. If you've been making more trips to the bathroom than usual, especially during the night, it may be more than a normal part of aging. Many older adults assume nighttime bathroom visits are simply something everyone experiences. While that can sometimes be true, frequent urination combined with ongoing thirst may point to blood sugar that deserves attention. As we discussed, your kidneys act like your body's filtration system. When blood sugar stays too high, they try to remove the extra glucose by sending it into the urine. Because sugar draws water with it, your body produces more urine than usual. The result is repeated bathroom visits that can interrupt your sleep night after night. One patient once told me, "I thought I was just getting older because I kept waking up 3 or 4 times every night." After testing, it became clear that elevated blood sugar was contributing to the problem. Addressing it helped improve not only bathroom trips, but also overall energy. Of course, frequent urination can have many causes, including certain medications, urinary tract problems, or an enlarged prostate. That's why it's important not to jump to conclusions, but to discuss persistent changes with your healthcare professional. Losing water isn't the only consequence. Your body's main source of energy can also become surprisingly difficult to use. Have you ever felt completely drained even after a full night's sleep? Or maybe you hit a wall every afternoon, struggling to finish simple tasks that once felt easy. Persistent fatigue can have many causes, but high blood sugar is one possibility that often surprises people. Think of your body like a car with a full fuel tank, but a blocked fuel line. The gasoline is there, but it cannot reach the engine efficiently. Blood sugar works in a similar way. Glucose, which is your body's main source of energy, may build up in the bloodstream instead of entering your cells. That's where insulin comes in. Think of insulin as the key that unlocks the door so glucose can move into your cells and be used for energy. When the body becomes resistant to insulin, those doors do not open as well. Even though plenty of sugar is circulating, your cells may still act like they're running low on fuel. Over time, this can leave you feeling unusually tired, less motivated, and more likely to experience afternoon energy crashes. Unlike the normal tiredness that follows a busy day, this fatigue often lingers even after rest. If persistent exhaustion is affecting your daily life, it's worth discussing with your healthcare professional rather than assuming it's simply part of getting older. Simple blood tests can help identify whether blood sugar is contributing to your symptoms. If your cells aren't getting the fuel they need, another surprising change may begin to appear soon. Many people believe that blood sugar problems always lead to weight gain. The truth is more complicated. Depending on what's happening inside your body, elevated blood sugar can be linked to either gradual weight gain or unexplained weight loss. Let's start with weight gain. When your body becomes resistant to insulin, it often produces more of this hormone to keep blood sugar under control. Insulin helps move glucose into cells, but it also encourages the body to store extra energy as fat. Over time, this can make losing weight more difficult, even when your eating habits haven't changed very much. Now here's the part that surprises many people. Some individuals actually lose weight without trying. If blood sugar becomes very high and the body can't use glucose effectively for energy, it begins looking elsewhere for fuel. It may start breaking down stored fat and even muscle tissue, leading to unintended weight loss. While some people welcome the number on the scale going down, unexplained weight loss is never something to ignore. Myth or fact? If I'm overweight, I must have high blood sugar. That's a myth. Many people with excess weight have normal blood sugar, while some people at a healthy weight develop insulin resistance or diabetes. Your weight is just one piece of the puzzle. It's the overall pattern of symptoms and your medical evaluation that tells the real story. Blood sugar doesn't just affect your metabolism, it can also change what you see every day when you look in the mirror. Have you ever noticed that your vision seems clear one day but slightly blurry the next? Maybe you've had trouble reading a menu, focusing on small print, or seeing road signs while driving. It's easy to assume you simply need a stronger pair of glasses, but sometimes changing blood sugar levels can also affect how well you see. Inside your eyes is a natural lens that helps focus light. When blood sugar rises or falls significantly, fluid can move in and out of this lens. These temporary fluid shifts may change its shape, making your vision appear blurry or causing your eyes to feel strained. That's one reason these symptoms can come and go instead of staying the same every day. Temporary blurry vision doesn't necessarily mean permanent damage has occurred. However, if blood sugar remains elevated over months or years, it can gradually harm the tiny blood vessels that nourish the eyes. Research suggests that managing blood sugar, along with regular eye examinations, may help reduce the risk of serious vision problems. If you notice sudden vision changes, persistent blurriness, or difficulty seeing clearly, don't simply ignore them or assume they're a normal part of aging. An eye care professional and your healthcare provider can work together to determine the cause and recommend appropriate treatment. Your eyes can reveal important clues about your overall health. But your eyes aren't the only place where blood sugar leaves clues. Your skin may also be trying to tell you something. Have you ever noticed that a small cut seems to linger for weeks instead of healing within days? Or perhaps you've experienced recurring skin infections or sore bleeding gums that keep coming back despite good hygiene. While these problems can have several causes, persistently high blood sugar may be one of them. Healing is a carefully coordinated process. Your body relies on healthy blood flow to deliver oxygen, nutrients, and infection-fighting cells to damaged tissue. When blood sugar remains elevated over time, circulation may become less efficient, especially in the hands and feet. At the same time, the immune system may not respond as effectively, making it harder to fight off bacteria and support normal healing. For older adults, this deserves special attention. A tiny blister from a new pair of shoes or a small cut from gardening may seem harmless at first. But if it heals slowly or becomes red, swollen, or painful, it should never be ignored. Gum infections and repeated skin infections can also be important clues that something more is happening beneath the surface. The encouraging news is that early action can make a meaningful difference. Managing blood sugar, Practicing good wound care and seeking medical advice when a wound isn't improving may help reduce the risk of more serious complications. If you have diabetes, regular foot checks at home and routine medical examinations are especially important because small problems are often easier to treat before they become larger ones. Sometimes the nerves themselves begin sending signals before any wound ever appears. Have you ever felt a tingling sensation in your toes that wouldn't go away? Maybe your feet burn at night, or your fingertips feel slightly numb when you button a shirt or pick up small objects. Many people blame these changes on aging or poor circulation, but persistently, high blood sugar can also affect the nerves themselves. Your nerves are like the electrical wiring that carries messages between your brain and the rest of your body. To stay healthy, they depend on a steady supply of oxygen and nutrients delivered through tiny blood vessels. Over time, elevated blood sugar may damage those delicate vessels, making it harder for the nerves to work properly. Doctors call this diabetic neuropathy, but simply put, it means the nerves have been injured. Imagine trying to water your garden with a hose that's become cracked and partially blocked. Water still flows, but not as smoothly as it should. In much the same way, damaged nerves may send weak, delayed, or confusing signals. That's why some people notice pins and needles, burning sensations, numb toes, or reduced feeling in their feet. The good news is that early recognition matters. Managing blood sugar and working closely with your healthcare professional may help slow further nerve damage and lower the risk of complications, including unnoticed foot injuries. Your nerves aren't the only tissues affected. Even your skin can reveal changes long before many people expect. Your skin can sometimes reveal health changes long before blood tests do. That's why it's worth paying attention to new or unusual skin problems, especially if they appear alongside other warning signs we've already discussed. One lesser-known clue is the appearance of dark, velvety patches of skin, often found on the back of the neck, under the arms, or in other skin folds. These patches may be linked to insulin resistance, a condition in which the body's cells don't respond to insulin as effectively as they should. While these skin changes can have other causes, they deserve a conversation with your healthcare professional. You may also notice that your skin feels unusually dry or itchy, even when the weather hasn't changed. High blood sugar can contribute to dehydration, leaving the skin less able to retain moisture. Some people also experience recurring fungal infections because elevated blood sugar may create an environment where certain fungi grow more easily. Here's a common myth. Skin problems are only cosmetic. In reality, your skin is your body's largest organ, and changes on its surface can sometimes reflect what's happening inside. Of course, not every rash, itch, or dark patch means you have diabetes, but persistent or unexplained changes shouldn't be ignored. The next warning sign often gets blamed on stress, poor sleep, or simply getting older. But blood sugar may be playing a much bigger role. Have you ever walked into a room and forgotten why you were there? Or found yourself rereading the same page because your mind just wouldn't stay focused? Occasional forgetfulness happens to everyone, especially during busy or stressful days. But if mental fog becomes frequent, blood sugar may be one piece of the puzzle. Your brain depends on a steady supply of glucose for energy. When blood sugar levels swing too high or too low, the brain may not function as efficiently. Instead of feeling sharp and alert, you might struggle to concentrate, lose your train of thought, or feel mentally exhausted even when you haven't done much physical activity. Some people also notice subtle mood changes. They may become more irritable, impatient, or frustrated over small things without realizing that fluctuating blood sugar could be contributing. These symptoms are easy to dismiss as normal aging, poor sleep, or everyday stress, but persistent changes deserve attention. Research suggests that keeping blood sugar within a healthy range supports not only physical health, but also brain function. Regular physical activity, balanced meals, quality sleep, and following your healthcare provider's recommendations may all help maintain steadier energy for both your body and your mind. The final warning sign is one many people never connect to blood sugar, yet it can become one of the most noticeable.